Hi, I'm Coach Amber, and welcome to the Meet RX podcast success story. And today we have a special VIP guest, Dr. Anthony Chaffee. Hi, Anthony. How are you?
I'm good. How are you?
I'm wonderful. I'm glad that you're on. So
Thank you.
let's get down to it.
Yeah.
Can you kind of give us an idea of what your life was like prior to starting Carnivore? Kind of give us an idea of what was going on in your life at the time.
Well, I was a university student and I was playing rugby at a high level. I was All-American and playing various all-star teams on the USA national team, pool and so forth, playing the Canadian Premiership, based in Seattle, but our team played in the Canadian Premiership. And so I was good. I was very healthy. I was meat-centric anyway, but I just ate other things out of sufferance. And I thought I felt very good. And then I didn't come across a carnivore diet per se, but I took a cancer biology class in university. And we learned day one, this is, how plants defend themselves is by being poisonous. Plants are alive. They want to stay alive. They don't want to die. If you eat them, they die. And so they can protect themselves. Nothing's come through the gauntlet of evolution without being able to protect itself more often than not. While animals can run away or fight back, plants can't. So they use poison as their main deterrent. Things that weren't able to are now extinct. So certain animals have evolved in their evolutionary niche to be able to break down specific poisons in specific plants, but it's very specific. They can't break down other poisons in other plants, so they don't eat those plants. So if you think about it, all plants are poisonous. It's just that certain animals have evolved the ability to break down certain poisons in specific plants. But even strict herbivores that only eat plants, they eat one or two varieties of plants, right? There's 400,000 plants in the world. Koalas eat one, pandas eat one, cows, horses, other grazing animals, they eat plants, that's it. The other things, they get sick or they die. So, the leaves that a giraffe eats are different from the leaves that a gorilla eats. These are different from the leaves that a deer eats, and so on. You mix those around, they all get sick or die. So we were learning this from a cancer perspective. So we were just looking at actual carcinogens. This is like 20 years ago. So we actually found more since then. But at the time, we learned that Brussels sprouts had 136 known human carcinogens in them. Mushrooms had over 100. Spinach, kale, lettuce, broccoli, celery, cabbage, cucumber. Every plant you've ever eaten, we were given lists that had numbers of the number of known human carcinogens next to them. 60, 80, over 100 known human carcinogens. And they're quite abundant. We've known since the 1980s from work that Professor Bruce Ames did at Berkeley, that the naturally occurring poisons that happen in plants, vegetables like spinach outweigh the pesticides that we spray on them by a factor of 10,000. And that the natural poisons are 1,000 times more likely to cause cancer than the pesticides. Okay, so this was quite revolutionary. We didn't know that. Literally, all of us were looking around, like looking for who was in on the joke. That is like, this has to be a joke. Who knows this? Looking for a TA or something. And we were wildly looking around, and no one was laughing. And I remember thinking in my head at the time, even though I hated vegetables, vegetables are still good for you though, right? And he must have read our mind, because he just looked at us and he just said, I don't eat salad. I don't eat vegetables. I don't let my kids eat vegetables. Plants are trying to kill you. I was like, all right, screw plants. And so I just stopped. And from then on, I went to the grocery store. I was like, okay, what? Everything's a plant. Everything has plants in it. Okay, everything that's there, bread and all the different sorts, obviously vegetables and fruit and so forth. But anything that had been made by someone else was going to have plants in it. And so I was like, well, I guess eggs aren't from a plant. Okay, it was milk, that doesn't come from a plant. And I was like, meat, that doesn't come from a plant. So I just ate eggs, meat, and milk for 3 years, and I felt absolutely incredible. My training went through the roof. I couldn't get tired. I couldn't run out of energy. I couldn't get sore. I would train 8 to 10 hours a day, every day during university. I never wore myself out. I could not wear myself out. The harder I pushed myself, the more my body responded. Obviously, when you're not in shape, there's certain limitations, but I always pushed myself. And I always said, everything I'm going to do, I'm going to do it 100% every time. And after a couple of weeks, my body just responded. And I got to the point that I could not get tired. And I did this for years. And it was absolutely incredible. I literally felt like a different breed of human. I didn't realize how poorly I felt before until I could see the contrast. I literally felt like a different breed of human because my body was just working so much differently than I had worked in the past as an elite athlete. Okay. I was already an All-American. I was already playing at a very high level, uh, while eating plants and carbs and sugar and so forth. Now I wasn't eating any, and it just really, really climbed. I remember playing professionally in England. I was 25 at the time, and I couldn't really get the food that I wanted in England. The meat, it wasn't great food. I mean, English food just isn't great food. But the meat that you could buy wasn't great quality. It was very expensive. Most of it was breaded. And I remember thinking, like, wow, was it breaded? I was like, is that big of a deal? It's not really much, It's like, maybe it won't matter that much, but it did. It made a big difference. I didn't realize at the time, but I started slipping off of it. And I remember thinking a few months after I got there, why don't I feel as just superhuman as I normally do? Why don't I feel as just as unbelievably amazing as I normally do? I couldn't understand. I was like, am I just not working out as hard? Like, what is it? Years later, when people say, like, oh, you have to eat plants, you have to do this, and it was like, I don't know about that. We learn very specifically there's a lot of harmful things. Oh, well, there's this one vitamin. Oh, there's this one thing in there that's really good for you. In broccoli, that my sister was doing her PhD at Johns Hopkins and in pharmacology and biostatistics, and one of her professors, part of his research was this chemical that was in broccoli that had all these benefits. And it's like, well, that's great, but there are 200,000 other chemicals in broccoli as well. What do those do for you? Are they at least neutral, or are they good for you, or at least neutral? So you give this one thing a net positive. So there's anti-VEGF in mushrooms, and that's something that we use for novel chemotherapy. Stops the cancer cells from forming new blood vessels and so forth. And so we use this as a chemotherapy agent. Okay, so they say, oh, well, this is really good. You should eat mushrooms because it's very anti-cancer. And my question is, do you have cancer? Then why are you taking chemo? Okay, that's not going to help you. Also, this is one chemical. There are more chemicals in there that cause harm and cause cancer. So you're eating something because it helps fight cancer, which you don't have, and can cause cancer 20 years down the line, that the mushrooms that you're eating will help fight, and you wouldn't have had it if you didn't have the mushrooms. So I just really didn't see why you would run yourself in that circle. And obviously we use cancer as a high watermark because it's cancer. But how does something cause cancer? It causes inflammation, it causes cellular damage, it causes genetic damage, it causes harm. It disrupts your mitochondrial respiration, and that deranges the metabolism of your cell and actually precipitates different mutations. And so these sorts of things are causing harm the entire time. They're causing your cells and tissue to not work properly and healthily. So whether or not you get cancer, you are harming yourself and you're going to feel it. So, I just never bought that. I never bought that these things were good for you, but I kind of was just eating them just because you're just so inundated with this information. Oh, you have to. I'm like, I don't know. And so, and I was, the new research was coming out that, sugar was causing these sorts of, causing all the harms that we attributed to fat and cholesterol before. And just, then we were then all the new research came out showing that was never the problem, cholesterol was never the problem, these things are all quite good for you, and so forth. And it all just kind of built up, and then you kind of see that. I actually saw Dr. Baker's interview with Joe Rogan a few years earlier, and his original one. My brother put me onto it, and he said, "Oh, there's this guy. He played rugby in New Zealand. He's a doctor, and he's saying that you can just eat meat, and you don't need to eat anything else." And I was like, and obviously this goes against everything that we were all taught our entire lives, and obviously what I was taught in school and medical school, apart from that cancer biology class. And I remember thinking, though, I was just like, well, I mean, I basically did that for 3 years, and I remember thinking, like, every 3 months, I was like, oh, should I eat a banana or something? Like, do I need some vitamins? And I was like, well, I feel good. My gums aren't bleeding, so I'm just going to keep rolling with this. And, so it's like, well, I mean, I did just eat meat. I was a carnivore for 3 years, and I actually never felt better in my life. And so I was just like, all right, well, I'll watch it and let you know if this guy's full of it. And within 5 minutes, it was like, this guy is more right than he knows. Is like, because I had, come across certain things with plants being toxic themselves, and, fat and cholesterol not being what we think it is, and the whole sugar sort of things. But I'm sure Dr. Baker, had come across it as well, but it hadn't discussed in the Joe Rogan meeting. And I was just like, but this guy's bang on. And there's a lot more to this. And so I started really digging into the literature and started looking into this, and and so and I started looking at medicine from a perspective of, we as a human animal are carnivores, and things just really started slotting into place. And when I approached this from that standpoint, medicine made a lot more sense. Human disease made a lot more sense, and which I don't think is disease. I think these things are toxicities, toxic buildup of species inappropriate diet and a lack of appropriate, species appropriate nutrition. So I had a kind of a second coming to carnivore diet, this time knowingly. I knew what I was getting into, and I knew why I was doing it. And at the time, I was you basically call it ketogenic, and I was just eating like spinach, kale, broccoli, and meat, and very lean meat. I was trimming the fat. I was eating less of it because I was trying to, tone up for rugby and so forth. And I saw this, and I was just like, I knew it. I knew the plants were bad. I knew these were horrible for you, and I just got rid of them. And I just started eating as much fatty meat as I cared to. And, I think I probably, I started eating a lot more fatty meat, and just a lot more volume of it. And I ate until my body told me to stop. And, I probably quintupled my caloric intake daily and just stopped the vegetables. And I lost 23 pounds in a week and a half. And after that, I stayed the exact same weight, but I started stacking on muscle and shredding fat. And for 3 months, I was this exact same weight every single day. I was 243 pounds. I know that because I was never 242 or 244. It was 243 on the dot every morning, every day for 3 months. And I lost more weight after that, but I attribute that partly to muscle loss, because I wasn't able to like lift weights and work out as much at that point, just time commitments and so forth. But it absolutely transformed my body and my mental state and my brain. Like for years I've been going through that kind of a cloud. I've been like, well, I got enough sleep, but I feel tired. I feel drought. I feel like I'm just not right. I attribute it to allergies and so forth. That was gone just by dropping the damn vegetables. I wasn't eating anything else. I wasn't eating any carbs, any sugar. I wasn't drinking. And just by getting this stuff out of my system, I was sleeping perfectly, which I'd never done in my life. I always had horrible insomnia problems. My asthma disappeared. I've had asthma forever. Gone now. I had red eyes like all the time. People would say, "Oh, are you high? Are you drunk?" I was like, "No, asshole. I don't drink, actually. Thank you." And sorry for swearing. And within a week and a half of just stopping the greens, my eyes were now white again. I would constantly have to use eye drops and things like that. It really, really bothered me that my eyes were so red all the time. And that was gone now, you know? And, you know, and the fog lifted from my head. My brain worked better. It was very strange, and amazing. And so it was just night and day. And now that I could consciously see it, I could see exactly what was going on. And I kind of marked my progress. I kind of every month I would take a picture and be like, wow, I'm so much more muscular now. I'm so much more lean now. And the next month I'd take a picture of myself. I'm like, ugh, what was I thinking? That was a fat piece of crap last month. I'm like, now I'm muscular. Now I'm lean. The next month I have the same thing. I'm like, ugh, what was I even thinking? Every month it was like that. That was how dramatic the differences were, in my body and everything. I could again, I was 38 years old. I could now train like I did when I was 20 years old on this same diet. And when I was 25 and not quite on this diet, I couldn't train nearly as hard as I can now. Okay. And it's all because of that, right? Because my body is now working to its genetic potential, which it was not before. I was poisoning it. I was curtailing it. I was stopping it from working properly. So again, I'm back down to, I can't get tired. I can't wear myself out. I can't get sore. And also I can't spend 8 hours in the damn gym anymore just because I work, unfortunately. But when I do get to the gym, it's kind of hard because I don't want to leave, because how your metabolism works when you're in a carnivore metabolism, ketogenic metabolism, which is actually our primary metabolism. It's the primary metabolism of all animals in the wild. It's not a starvation state. That's a ridiculous thought. But you create energy for what you're doing. Sitting here talking to you, I'm producing the exact amount of energy I need to sit here and talk to you, right? When I start working out, I produce enough energy I need to work out for whatever I'm doing. We take stimulants because that causes us to burn more energy. We feel better when we burn more energy. That's why we take stimulants. But I feel that I burn more energy when I do more, and that makes me feel better. So it's a positive feedback loop. The harder I work, the better I feel, the harder I want to work. I don't want to stop. So we call it a runner's high, right? If you look at these, they call it endorphins. I remember thinking as a kid, well, what endorphins? We have names for chemicals now. Which ones are these? Well, they're just endorphins. All these endorphins. It's not endorphins, but maybe some endorphins. But there's also fundamentally this production of energy and this heightened metabolic state that you're putting yourself into that makes you feel better. So, traditionally you say you run until you kind of hit the wall, and that's where usually people stop. But runners will tell you, and athletes will tell you, if you push yourself, you can break through the wall and you get your second wind, and you're this runner's high, and you just feel forever, and you can just go forever. Okay, well, what that is biochemically is when you're eating carbohydrates, you lock down your energy mobilization. You can't access your fat cell storage. You can't. It blocks proteolysis. It blocks lipolysis, and so you can only run on your blood sugar and your liver glycogen, muscle glycogen, and so forth. But that is going to have a limit. It's going to run out. Whereas in the other state, you're producing everything that you need all the time. So you're going to hit the wall because your insulin is going to stay up for about 24 hours, and that's blocking that. So you're going to run out eventually. It doesn't matter who you are, you're going to run out. And that's going to be the wall. Normally it takes about 24 hours to reset your metabolism. But if you keep pushing, you'll kind of sort of force it to flip back over, and you'll start producing energy like you're supposed to, and you feel amazing. Okay. And you get your second wind, you get your runner's high. Well, I live in that second wind. I'm always on a runner's high. So when I work out, it's amazing. It's like a drug. I love it. And so I have to be careful because I work quite a lot at the hospital and, doing neurosurgery. So it's very demanding. I generally only have a couple hours after work until I need to be asleep to get enough sleep to be functional the next day. I don't always have weekends off. And if I do, I'm packing with a lot of other things. And so I may not get to the gym for a couple weeks at a time. Because of this stupid COVID nonsense, like I haven't been in the gym in months, but I still look the same. I still am very muscular. I'm still very lean. I eat as much fatty meat as I care to every single day. And I go between 3 and 5% body fat, just because that's where my body wants me. And so, when I do go to the gym, I have to be careful, because this is like, I know if I go there, I'm going to be there for 4 damn hours, because I'm not going to want to leave. And so once every 2 weeks or 3 weeks or whatever it is, I'll go, but I won't just do, 3 sets of 10, 3 sets of 10, 3 sets of 10, different sorts of things. I'll do a bunch of different sorts of workouts, but I'll do a main sort of big workout like squats or bench or shoulder press or deadlifts, so forth. And I'll do 20 sets. So I'll do, 20 sets of bench, 20 sets of squats, 20 sets of deadlift, or I'll do like a big circuit, but I'll do squats in between. So I'll do shoulders and then squats, and then this and then squats, and then that and then squats, and then this and then squats, and then this and squats. And I'll just go like that until I run out of time, because my body doesn't wear out. So I can do that now, and I couldn't do that at 25, but I could do it at 20 to 23 and a half, 24. It's all because of the diet. It's all because my body is now working how my body is supposed to work. Whereas before I was poisoning myself. So, I tell people, and people say, like, well, don't you want to drink, or don't you want to eat this or that? And it's like, I have zero interest in any of that, because I would rather feel like a superhuman or like a superhero 24/7 than be drunk sometimes. Like, that's just not worth it to me. I just don't care. And the rare occasions that I would drink, literally once every like 14 months has been my average for the last few years. I won't even be hungover the next day, but I will feel that knock-on effect in my workouts for 3 weeks. Okay. So instead of being able to do 20 sets and wanting to do another 20 more, but having to drag myself away, I'll get, 6 or 8 sets and really be worn out and really just like, oh God, I'm just not feeling it today. This is a week after, 2 weeks after, 3 weeks after, and I'm getting up to the 10 mark, but I can get like 10 sets or this. I'm just, it's not really feeling it. That is insane that it affects me that long. But I feel it, and I felt it, every time after that I've done that. And so, yeah, good friend's wedding, I drank then, fine. But I felt it for 3 weeks. Another good friend's birthday, we went to New Orleans with a bunch of guys. Like, this is clearly a drinking weekend. And so I drank one night, and then I was like, not doing that again. And I felt it. So it's a massive difference before and after. It's night and day. And because I've seen such a great result with it, and I've seen such great results with my family and with my patients, this is something that I love to talk about with people. Free of charge. I just talk to people just because they show interest in it. Then I'm interested in telling them about it and directing them to resources that can help them with that. And I'm trying to incorporate it in my own practice, but it takes more time for me to do that, because I'm trying to explain these sorts of things to them. It could be easy just to kind of bang through and just do the normal sort of medicine thing, like, oh yeah, this is what you do, this is what you do, here's the recommendations, and bye. But I do take the extra time with people, because I think it can help them quite significantly. I don't try to push it on anyone. I just say, here's some resources, especially in a professional setting. I think that, that's not appropriate. I think that, there's very strong evidence that these things can help people in various situations. And so I just say, this is what I've come across. There's quite a lot of evidence to say this. Here are the resources. You take a look and you decide. And if you have any questions, please feel free. But it's for me, it's absolutely life-changing. I'm furious that I haven't been doing this my entire life. I'm absolutely livid. And, it's like in all of us, we haven't developed, to our genetic potentials, right? Our mothers weren't carnivores preconception, during pregnancy and breastfeeding. We weren't eating exclusively meat our entire lives. And that really kind of pisses me off. So I'd probably be another 6 inches taller and 50 pounds heavier. I'd be a force of nature just walking through. I have a good friend of mine that's, she lives in Ireland. She has a young daughter. She was coming across different posts that I was doing on Facebook and so forth, and talking about these sorts of things. She was pregnant. She was 32 weeks pregnant. She had hyperemesis for 32 weeks, meaning she was projectile vomiting every day, all day. And she was very, very sick. And she came across my things. She said, you know what? I trust him. What he's saying is making sense. He's citing all the reasons why he thinks these things and all the different sorts of studies and articles and so forth. She's like, I'm going to give it a try. The day she stopped eating plants, vomiting stopped. And she had a completely, flawless pregnancy. After that, kid, was born fine. She developed fine. She was eating just meat, fatty meat, and oats, because her mom said that, well, if you eat oats, that helps bring in your milk. Fine. But, I wasn't trying to push anything, but I was just like, well, with eating these carbohydrates, it fundamentally changes your metabolism. There's different things in there that are harmful to you. They could well possibly be crossing, into the milk as well. It's just something to think about. After 3 months, she said, you know what, I'm just going to do it. And she just stopped the oats. It was the only difference. This child was 50th percentile in head circumference, length, and weight. 1 month of mom just dropping the oats. Everything else is the same, just dropping the oats. Whatever happened to her breast milk, this kid, 1 month, went to the 99th percentile in head circumference and length, and started trying to walk at 4 months. And her head grew so fast and so quickly that the nurse, the pediatric nurse, thought this must be hydrocephalus. This is a disease. There's something wrong. And so she's like, well, she's not wrong, because she's smart, she's bright, she's interactive. And so she went to a specialist, pediatric neurosurgeon, and was just sitting there, and this little 4-month-old baby is sitting on her lap, and she's just kind of sitting there for maybe 5 months at that point, sitting on her lap, and I'm like, I really shouldn't be here. And the doctor was sitting there, and he had his desk, and he had this little picture of his family, the family dog kind of sitting there. And this 5-month-old baby just points at the picture and goes, dog. And the doctor just went, she's perfect. You don't need to be here. And so it went on like that. This kid is fantastic. I still get updates. Head's massive, big old head. And, and now she's pregnant with her second child, and she's been carnivore for years now. And, the baby's developing so much better and so much quicker. They're moving up her expected delivery dates, because the child is developing faster than, other people do. Well, we're not developing to our genetic potential, right? And, this kid, or her daughter, who is 3 now, she, 2.5, 3-ish, she is going so far past these milestones so much quicker than other kids. It's like, well, no, this isn't anything special. This is actually how we're supposed to develop, which none of us have done. And so it's quite remarkable. And so that pisses me off that I didn't get that. It would have been nice. Yeah. But yeah.
I could not agree with you more. Your story is absolutely fascinating. Thanks so much for sharing that. But I am with you. Being only 5'2", I'm like going, maybe I wouldn't have had to deal with that. Maybe I'd be a supermodel, who knows?
Yeah.
But I didn't, definitely. My mom ate salads. I mean, that's what was good. She came from an obese family, so she was absolutely not going to be like that. So she made sure she ate good. And, you know, and that's just kind of how you're raised. And it ticks me off too, because I struggled for 40 years dealing with obesity and, you know, that kind of thing. And maybe I wouldn't have had to if we had the
Yeah.
correct information. And that is infuriating. I'm completely with you on that one.
Yeah.
Okay, so for the last question, you pretty much went over everything that I was going to ask you, so that's awesome. But
Okay.
could you take us through a typical day for you as far as what you eat? I'm sure people are very curious, like maybe even quantity, specifically what fatty meats. And you already mentioned you don't do alcohol except for on rare occasions. Do you include dairy now? Do you still eat eggs? What about coffee?
Mm.
Anything unique?
Yeah. So coffee's a plant, and so I don't do plants. Yeah. So my hard rule is no plants, no sugar, nothing artificial, and that goes for sauces, seasonings, and drinks, and so forth. Seeds are, as I mentioned, talking with Dr. Baker. Um, every organism protects their babies more than anything, and a seed is a plant's baby. So that's where you'll find a high proportion of toxins is in the seed. So that's definitely something I avoid. Just jumping back, I tried testing, saying I don't get sore after a workout. I don't get sore after a workout. I tried to put that to the test. I was like, well, maybe I'm just not working hard enough. And so I did a heavy leg session, and then I was like, I was going to end with squats, and I just kept doing squats until I was like, I'm just going to wear my legs out, and and see how I go. And so I ended up doing set after 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 set. And I was listening to a book on tape of my favorite author and thinker, Thomas Sowell, who's a brilliant economist and philosopher and historian. And so I was interested in that, and I just kept doing these sets. And after a while, I realized I'd done an extra 20 sets on top of the 12 sets of heavy legs that I'd done. So now I've done 32 sets of extremely heavy squats, or leg workouts to failure. And I was nearly doing as many reps on the last set as I had done on the first set, maybe off by one or two. And I literally, my leg, I was like, I could literally keep doing this for the rest of the night. But I've been here for 4 hours and I've got shit to do. And so I stopped. And the next day I was talking to someone, and they was like, oh, we should go hiking tomorrow. And, I've overdone it on leg workouts before, and just been crippled for like 2 weeks. And this was way more than anything I'd ever done. And I also hadn't really worked out in months because I'd just come back from Bangladesh. And they were like, oh, we should go hiking tomorrow. I was like, easy. I may have just done something very stupid. So let's see how I'm feeling in the morning, and we can go from there. Next morning, it felt like nothing had happened. And I was walking up the stairs, nothing happened. I went 2 at a time. I was like, yeah, I can kind of feel it. My hamstrings are kind of talking to me. They've done some work, but they didn't feel sore. They didn't feel tired. I could easily have done it again. I was like, all right, let's go hiking. Hiked 3 hours up a mountain, came back down. And I was like, okay, I'm ready to go back to rugby. And I went to rugby that night with the professional team in Seattle, the Seattle Seawolves, who was my team growing up, sort of morphed into that. And so I was going to practice with them in this sort of the inaugural season. And these guys have been, practicing sort of heavily, sometimes twice a day, for sometimes 6 days a week, for all the months that I'd been in Bangladesh. And so they were in very, very good shape. I was not. I was at a dead sprint and running all over this practice. It wasn't, I hadn't missed a step. And the day after that, it was just like, okay, yeah, I can definitely tell that my legs have worked, but they're not sore, they're not stiff, they're not causing me a problem. I can still do everything I need to do. The day after that, usually, second day after, you have 48 hours, you have this peak of your inflammatory pathway. That's usually when they're the most sore. I wasn't sore. I went for coffee with a friend of mine. I was like, all right, well, I haven't had coffee in a few weeks. Let's see, how does this affect me? Because I would sample things back in to see what happened. And I had 1 cup of black coffee, and within 20 minutes, my hamstrings started locking up. My back started getting stiff and aching. I could literally feel my body starting to lock up. And I was just like, okay. Oh, what's happening? All right. Okay. And I was sore for the next 2 days, and wasn't close to what I would have been normally, but I felt this happening. So no, I don't drink coffee because I know what it does to me. And I feel better without it because my body makes all the energy that I need for what I'm doing anyway. So a typical day for me, I don't eat breakfast generally. When I'm hungry, I eat fatty meat until I'm full. But if I get enough fatty meat, I find that I'm not hungry for 24 to 30 hours. I haven't eaten today. It's, 2 in the morning nearly. I've worked all day. I was on call, you know, Wednesday through Thursday. I worked basically 36 hours straight with maybe a couple hours of sleep. That's it. And, I haven't eaten today either. I feel fine. I usually just get up in the morning and I go. I don't have to make breakfast and do all these sorts of things. I just get up, I shower, I get ready, I go. I don't have to stop for lunch. I don't slow down towards dinner. I don't go like, oh, I got to eat something. I just go. And then when I get home and I'm done with everything I need to do, I love beef. Beef is, I feel the best. I'm kind of at the sharp edge of this, just like, probably yourself and Dr. Baker are. I've been doing this for years now. I can actually feel the difference between the different kinds of meat. And so, I really prefer beef. That's when I feel the best. I feel fine with pork and bacon and chicken and eggs. Feel fine, but I feel fantastic with beef. And so that's what I normally eat. Like ribeyes and things like that. They're fatty. Brisket and chuck, different sorts of things that you use a slow cooker for, but have a very good flavor and very good fat content. Those are the type of things that I go for. And so I make more than I think I'm going to want. And I eat until my body doesn't want me to, because, and I go by taste. I have some patients that, especially when they're trying to lose weight, they're thinking portion sizes. Like, well, I eat three, you have to eat 3 times a day and you have to eat a certain amount and so forth. And I say they really struggle. They say like, well, I'm really not liking this. It just tastes horrible. I have to force feed myself to do this. It's just awful. And I ask them, does it always taste awful from the beginning? And they say, well, no. I mean, at first it tastes really good, but then, halfway through it just tastes awful. And I have to force myself to finish it. It's like, don't finish it. That's your body telling you you're done. It's the same chemical, right? You're eating the same steak. Tastes amazing here, tastes awful here. Why is that? It's the same chemical, right? If it should be giving the same chemical reaction, but it doesn't. That's because it's not a 1-for-1. Okay, this is your brain saying like, we have these nutrients or we want these nutrients. That's what flavor is. I forget who said it, but it was a famous quote. The best seasoning is hunger. Like anything tastes good when you're starving, but meat tastes amazing when you're starving. And so, I tell them, it's just like, just eat to taste. I tell them, it's like, if a steak doesn't taste good, you're not hungry. But if it does taste good, you are. So listen to that. Listen to your body. And so I do that as well. I tend to eat once a day. Eggs are fine. I have no problem with eggs. I like eggs. I even use it when I get like sort of the fat drippings in the pan and things like that. I'll often pour that back over my steak, but or I'll get like 8 or 10 eggs and just kind of whip them up and scramble them in that in those drippings, and to get that fat because I want the fat. I think that I haven't really strayed too much from that. Fish is fine, chicken's fine. Anything that moves and had a face, I think is fine. Some people have problems with shellfish, and so that's why I include the face part of that. But by and large, any sort of animal body part, you're going to be okay with, especially the muscle and so forth. So I think that just people should eat whatever food they enjoy and makes them feel good. And I don't think that there's anything, people like certain things. It's fine, But I don't know. I have a pretty dramatic looking fridge, Probably very similar to other carnivores fridges, but I think it's amazing. Every time I show it to people, they're like, "Oh, okay, this guy's not joking around." And I don't know. I do try to, when you kind of get good at cooking meat, and so what I do is I'll buy in bulk. I'll go to places and buy like a whole ribeye loin, I'll cut up into like big fat steaks. And something that I learned from Alton Brown, who's a famous chef, written a bunch of books and stuff like that. Is an interesting guy. Talks about like the chemistry of cooking and so forth. It's quite interesting. But one of the tricks I got from him was you just basically salt the hell out of the meat, all sides, and put it on a drying rack, not touching anything else, and you just let it sit there for at least a day. I do it for up to 2 weeks. Dries out a little more, maybe not the best texture at that point, but the flavor is amazing. And I find that one day after it's much better, and then 5 days after it's even better. The sweet spot's between like 5 and 7 days, but it's perfectly fine after that. And so that's my meal prep. Is like I'll cut up one of these big sorts of things, put it salted, put it on these racks, and that's what I eat for the next 10 days. And then I'll do it again. I just grab a big steak and do that every day. It's the easiest thing in the world. I've got an extra 6 hours of my day to myself that I'm not, thinking about preparing or eating food. My life is my own. I'm not beholden to restaurants and going to lunch and to dinner and to breakfast and all these sorts of things. Like I just eat, and then I get on with my life. I do things. I've never, I talked to so many people during this whole COVID thing, and they're saying it's like I never realized how much I relied on restaurants, not even bars and restaurants, just restaurants, and how much of my life had to do with going to restaurants. So I don't do that. I don't care to. And, I have a lot more of my day to myself, which I really enjoy. Yeah. And I make these steaks, and I'm very good at it now, I think. And other people will come around and I'll have something like, here, try some. And they'll eat it, and I'm like, Jesus, like that's amazing. And it's like, this is all you eat all the time? Like, yeah. I was like, well, no wonder you don't go to restaurants. It's like, no wonder I wouldn't only eat this. And like a lot of times people have come around based on that. They were like, oh, I thought I'd get bored with it, but it's like, that is amazing. And it's like, if I can eat that every day, like I'm in. And so that's what I do. And yeah, I don't know if I can probably show you my fridge, but I think it's dramatic. I think it's awesome. But I'm going to show you my fridge. Let's just do that.
Okay, go for it. Oh, wow.
I think that's great.
Okay, that is dramatic.
Yeah. And so like all those different steaks are salted and up on the racks and things like that. And then I've got these guys down here, which are wet aging. So you keep it in that cryovac container. They wet age. So you look at these very nice steakhouses and things like that. They'll just talk about, this steak is 30-day wet aged, 30-day dry aged, sort of thing. So that's wet aging. Is in that sack, in that little pack. Because you can do that for up to 30 days, and you'll be fine. And then so take those out and just cut them up and go, and they kind of dry on that rack. It's not really dry aging, but it does dry it out. It takes a bit of the moisture out, concentrates the flavor, and that salt gets in it. And just like every single bite is now perfectly salted. And it makes a big, big difference. And yeah, so it's been very enjoyable, and that's what I eat.
That's awesome. I am definitely going to be trying the salting thing. Love Alton Brown too. He's pretty awesome. I
Yeah.
used to watch him all the time back when I watched the Food Network, which I don't really watch anymore, but
Yeah.
every once in a while, Guy Ferrari, kind of still like him, but
Yeah.
not that I would ever go to the places he goes to. But
Yeah.
anyway,
They're good
well, thank you
personalities,
so
definitely.
much. Yes. And thank you
Yeah.
so much for sharing your story. It's been amazing. And I love the tour of your refrigerator. That's pretty amazing.
Yeah.
I'd
Yeah.
like to grab a hold of some of that for sure.
Yeah.
But thank you again for being on the podcast. I think it's going to be very interesting to a lot of people. And everyone, be sure to catch Dr. Chaffee's interview with Dr. Sean Baker. That was also a very good interview. So be sure to catch that. And you have a wonderful day. And again, thank you so much for being on.
Well, thank you very much. I appreciate the opportunity.
Bye.